Welcome to the Newton Model A-E ventilator training. The Newton Model A-E ventilator has not been cleared or approved by the FDA. The ventilator has been authorized by the FDA under an emergency use authorization. The ventilator is authorized only for the duration of the U.S. declared health emergency. The Newton Model A-E ventilator is manufactured by Ford Motor Company for GE Healthcare and distributed by GE Healthcare. For customer service, call GE Healthcare at 800-345-2700. Do not contact Aeron directly. Direct all inquiries to GE Healthcare. The design of the device is based on a design from the Aeron Corporation. When you receive your Newton Model A-E ventilator, it will come with two boxes. One will contain the Newton A-E ventilator, and the other will contain the accessories. The ventilator box contains the Newton A-E ventilator, user's manual, quick reference card, and emergency use authorization documents. The accessory box contains 3 breathing circuits, the bed rail mount assembly, and a high-pressure oxygen hose. The Newton A-E ventilator comes with a bed rail mount assembly. The assembly comes with 2 brackets and 6 screws. Place 1 bracket on each side of the ventilator and use the screws provided to set in place, as shown here. For additional information on the assembly of the bed rail mount, please refer to the packaging instructions. The Newton A-E is a pneumatic ventilator designed to ventilate critically ill adult pediatric patients 50 pounds or greater. The modes of ventilation offered on the Newton A-E are controlled mandatory ventilation, CMV, intermittent mandatory ventilation, IMV, continuous positive airway pressure, CPAP, and pressure limit. The Newton A-E has easy-to-use tidal volume and rate controls with built-in CPAP and can quickly be set up and operated. Clinical uses for the Newton A-E include inter- and intra-hospital transport, including use in the ER, special procedures, and disaster management planning. Let's start with the features and controls of the rear panel. Gas input connection. The gas input connection requires connection to a high-flow oxygen source of 55 psi. Audible alarm. The audible alarm alerts when a patient disconnect has occurred or when the oxygen gas pressure drops below 30 psi. Ambient air intake. The ambient air intake filters air as it enters the ventilator's entrainment system. Moving to the front panel, we will start with the 4 primary controls for ventilator setup. PEEP CPAP control. The PEEP CPAP adjustment adjusts to 20 centimeters of water pressure with automatic sensitivity for changing patient needs. The demand flow rate is provided up to 140 liters per minute for the spontaneously breathing patient. The FiO2 delivered during spontaneous breathing is set by the percent oxygen control. Peak pressure control. The peak pressure control should be set above delivered patient pressure. This control limits peak airway pressure to a maximum of 75 centimeters of water pressure. Additionally, this control would be used to set a delivered peak pressure for pressure-limited ventilation. Tidal volume control. The tidal volume control has a range from 360 to 1,500 milliliters for adult and pediatric patient needs. The Newton A-E uses a preset flow at 36 liters per minute for mandatory breaths. The tidal volume has been calibrated for patient delivery independent of changes in patient condition. Patient mandatory breath rate control. The respiratory rate control has a range of 3 to greater than 28 breaths per minute. The control has a wider range at the lower respiratory rates to provide better control for slower IMV rates. Patient respiratory rate should always be monitored to ensure adequate ventilation. Alarm controls. The alarm controls include the alarm visual indicator and the alarm reset silence button. The alarm reset silence button silences the alarm for 1 minute. The alert condition is activated when a patient disconnect has occurred or when low source gas pressure is detected. Oxygen control switch. With its variable oxygen control system, the operator can choose between 100% and 65%. Both mandatory and spontaneous breaths are delivered at the set O2 level. Mandatory breath control. It turns on and off all mandatory breaths. In the off position, the Newton A-E provides CPAP only. The Newton A-E is designed for ease of use with handles that have finger grips that extend from the front panel, making the ventilator easy to transport. The Newton A-E with its visual controls and a pressure manometer to assess patient ventilation with transport. To connect the patient circuit to the Newton A-E ventilator, connect the large hose end to the patient connection port and the small hose end to the expiratory valve port on the front of the ventilator. Clinicians may use an ET tube or face mask with an angle connector. It is important to note that the Newton A-E is calibrated to the recommended circuit. The use of any other circuit is not recommended and may cause PEEP, CPAP, and peak pressures to be inaccurate. Higher inspiratory work of breathing during spontaneous breaths and expiratory flow resistance may be higher. Let's take a look at the operation of the Newton A-E ventilator. When we first turn on the gas, the ventilator will alarm. Press the reset silence button to silence the alarm for 1 minute. The alarm is set to sound after 20 seconds if no mandatory breath is delivered with a minimum of 15 centimeters of water pressure, if CPAP is set less than 4 centimeters of water, or if there is a loss of gas supply.
Next, let's discuss patient setup using tidal volume and respiratory rate controls. Set the desired patient tidal volume between 360 and 1500 milliliters and the respiratory rate between 3 and 28 breaths per minute or greater. With a preset peak flow, when you change the tidal volume, your inspiratory time changes. Changing the respiratory rate changes the expiratory time. It is recommended that the clinician always monitor the mandatory respiratory rate. For further information on the interaction of tidal volume and respiratory rate, please refer to your user's manual.
The peak pressure control should be set above the delivered pressure at a desired setting to assure patient safety. Set the percent O2 control at either 65 or 100% so the ventilator is ready for any critical situation. Make sure your mandatory breath is set to on. Add PEEP as needed. The Newton A-E offers other modes of operation including CPAP and pressure limit. Let's look at the operation for the CPAP system. For a spontaneously breathing patient, we can turn the mandatory breaths to off and adjust the CPAP to the desired level. As you can see, the CPAP system is very responsive with very low work of breathing. The integrated CPAP PEEP supports the IMV mode by turning the mandatory breaths to on. You can also ventilate in pressure limit mode. The peak pressure control can be used to pressure limit breaths for pressure ventilation. Let's address some additional clinical environments where the ventilator may be used. Pediatrics. For pediatric usage, remember that the Newton A-E ventilator is approved for patients 23 kilograms and above. The Newton A-E can be used as a pressure-limited ventilator measuring volumes and inspiratory time. Clinicians should monitor respiratory rate pattern as the ventilator's fixed flow rate at 36 liters per minute may be too high for some pediatric patients. Air transport and high-altitude operations. For air transport and high-altitude operations, the Newton A-E's delivered tidal volume will increase and respiratory rate will decrease as altitude increases. For this reason, the use of an external spirometer is recommended. Pressure settings will not change as altitude changes and is approved for altitudes up to 15,000 feet. Do not use the ventilator in hyperbaric chambers as the delivered tidal volume will drop rapidly as pressure increases and it is not indicated in that setting. The Newton A-E is not approved for MRI use. A bacteria filter is recommended on the output of the ventilator. This will protect the patient and the ventilator from contamination. Patient safety features. There are a number of patient safety features. Audible and visual alarms are for patient disconnect and gas supply pressure below 30 psi. High pressure release uses the peak pressure control and warns of excessive inspiratory flow and volume. Internal safety pressure release limits circuit pressure to 80 centimeters of water pressure, regardless of the setting of the peak pressure control. Anti-suffocation system. In the event of a ventilator malfunction, an internal valve will allow ambient air to enter the patient's circuit. Cleaning and maintenance. The operator should clean the ventilator between patient use by using a mild detergent or disinfectant and water with a soft cloth. Do not immerse the ventilator in water. The Newton A-E patient breathing circuit is single patient use and should not be cleaned, disinfected, or reused.